Welcome to the other side of medicine. I'm Dr. Christosic, aka Dr. J. Glad that you're taking the time to join us this evening. We have a special treat for you tonight. Some of you may be familiar with what the topic will be about tonight. Some of you will be quite surprised. We're going to be talking about the oral health and specifically the bacteria called the microbiota living in the mouth, the microorganisms living in the mouth. We'll be discussing that with a dentist who practices a very interesting form of dentistry, a natural form of dentistry. She's a doctor that has graduated from Case Western Reserve Dental School. Her name is Dr. Skordeles. She'll be joining us in a few minutes. And Dr. Skordeles, Dr. Christine, as she likes to be referred to, is a native of Cleveland, and she ended up doing her residency in New York City and then started her practice there, and that's where she's been. But my friends, you'll be glad to know that she's going to be opening up an office here in Medina, Ohio. We'll talk about that tonight as well. But before we dive in and meeting Dr. Skordeles, I want to talk a little bit about this topic of the oral microbiome. Now, many of you are familiar listening to the other side of medicine. And of course, if you're a first-time listener, you have heard about the gut microbiome. The bacteria living inside of our gut has become a very, very dominant topic in nutritional field, in the field of healthcare, natural medicine, functional medicine today. It is the buzzword. The gut health has become paramount in so many illnesses. And most people don't recognize that our mouth has a lot of bacteria, over 700 different types of species of bacteria living in the mouth. And the oral microbiome is the second largest microbiome in the body. First is the gut, has the most bacteria living inside it, and then the mouth, which a lot of people don't understand. And we're going to talk about the significance of that tonight and how the bacteria in the gut and our health of our mouth, the oral bacteria, communicate with each other. They literally crosstalk with each other. It's called the gut and the oral cavity access. And we're going to get to discussing about that tonight and the significance of that. So we've got a lot to talk about. And the immune system is affected by the bacteria living inside of our mouth, and the health of our mouth and the gut, bacteria living inside of our mouth. The immune system is impacted in a profound way by that. Also, entire body is affected by it. Researchers now are literally showing a connection between the bacteria living in the mouth and all of our body systems. So our lifestyle factors, we're going to get into talking about that tonight, how our lifestyle, how we think, what we eat, how we move, our food choices, all these things play a significant role in the health of our oral cavity and the types of bacteria we have living there. And so take some notes tonight, because our special guest, Dr. Skordeles, is very wise in this area and one of the leading dentists in our country. Dr. Skordeles, welcome to the other side of medicine.
Thank you, Dr. J. I appreciate the invite and the honor to talk with everybody. And it's going to be like a little fireside chat tonight. I'm really looking forward to all of the really great stuff that you're talking about. I'm a native Clevelander, and I ended up in New York City doing my residency program and ended up staying. And it's been a wonderful experience because I've been able to be in contact with some of the best doctors in the world, lectures, and exposed to so many cultures and so many people from everywhere. And one common theme is when patients doesn't matter where they're from in the world, could be the smallest place on the planet, when they have really good mouth care and really good diets, their gums reflect it, their teeth reflect it, and the rest of their body actually stays healthy. And I have been fortunate enough to be practicing in this preventative mode for my entire career in New York. And I'm now going to be bringing that to Medina and bringing in the connection between being a biomimetic, which means following nature doctor, and doing very conservative treatments as I'm following nature. And at the same time, I'm connecting all of this back into preventative, if you will, preventative dentistry and medicine that is linked in with all of our lifestyle factors and what we do in the office and what you do at home on a daily basis. So these are the things that are really, really important. And our oral bacterias are affected essentially by absolutely everything that we place in our mouth. And it's also how we think too.
Well,
And some,
Dr. Christine, I'm going to call you that, right? Is that okay?
yeah, that's fine. Thank you.
So you've been a trailblazer in this area of the oral microbiome. How important is that to the health of our teeth, but not only our teeth, to the rest of the body, the entire body?
So when you have an imbalance of bacteria in the mouth, for instance, when you're on a high sugar diet and you have very acid loving bacteria in the mouth, those acids are secreting, those bacteria are secreting acids, and those are what are causing you to have tooth decay. They're causing you to have tooth inflammation. They're also the change in your in your daily routine, so to speak. So when you have the highly sugared or highly acidic energy drinks or all of that kind of stuff, that every bit of that affects you, whether it's first thing in the morning or the last thing that you do at bedtime. All of these factors affect what happens in our mouth and the bacteria in our mouth. There are bacteria that actually secrete nitric oxide, and research is looking for ways to increase those nitric oxide loving bacteria in the oral cavity, because what does nitric oxide do? It helps regulate, it's one of the regulators of our blood pressure. So if you have low nitric oxide in your bloodstream, your blood pressure is going to be very, very high. So there's so many new things that have happened since when I graduated dental school more than 25 years ago. And back then we knew that there was oral systemic things that were happening in our body, but we couldn't put the links together. Now we're able to put those links together. And that's really, really important for people to understand.
Dr. Christine, I know that the medical community and the dental community saw the first link with the bacteria living inside of the mouth with a heart condition called endocarditis. That was the first introduction that they started to study that. And since then, it's really come a long way. Talk about how serious endocarditis is from, getting and contracting that condition from the bacteria living in the mouth affecting the heart.
Correct. So what endocarditis is inflammation of the heart. So your physical heart has just been, if you will, attacked by bacteria. It's so mission critical that it's very, very infrequent, number one. And number two, when a patient actually has endocarditis, which is that inflammation of the heart, they are in the lifelong high risk factor for having endocarditis again, number one. And number two, it affects their entire lifestyle. They're not able to do as many things. Their heart muscle is not functioning the way that it should. There's so many factors. And that is why when there are dental appointments, that some patients need to be pre-medicated with antibiotics prior to a dental appointment, such as for a brand new hip, for prosthetic joints, that sort of stuff. Some patients, especially if they're a heart patient, the cardiologist will highly recommend that they medicated with antibiotics. And it's because of this endocarditis. They don't want bacteria from oral cavity to go into the bloodstream. And that's what happens every day when we brush, especially if patients have bleeding gums. That's a big sign that that's literally an infection. and that you need to curb that infection. So by brushing and also the correct diet and not doing the high acid loving foods, that will actually help.
Well, since the connection between the bacteria in the mouth and endocarditis has been revealed by the medical community and the seeing a direct causation, now the medical community and the dental community recognizes there's a lot of different illnesses that are triggered because of the bad bacteria living in the mouth. Let's talk a little bit about that right now. What does the research say?
So some of the research currently is pointing to the fact that some colon cancer, a majority of it, is actually caused by high amounts of a bacteria called Fusobacterium nucleatum. And that bacteria is only found in the oral cavity. That bacteria, when it migrates into the gut, and it's not actually even in the gut, it's now in the colon. So it's in the lower gut. It actually causes colon lesions and colon cancer. They have found that that's a very large one. The second largest one with the Fusobacterium nucleatum, which is a very highly toxic bacteria as well, it causes fetal demise. And you may ask, what do you mean fetal demise? Late stages of pregnancy, where for unexplained reasons, the baby is actually it dies. And they have found that this bacteria actually goes into and crosses the placental barrier, and it actually will suck up all the glucose out of the amniotic fluid, and it kills the kid. It's crazy.
Wow.
So
speaking of the amniotic fluid, we used to think it was sterile, and we used to think that there wasn't any bacteria the baby was exposed to in the womb. But that's changed dramatically now. We know now that there is bacteria there, and the baby's exposed to some of these microorganisms, and their microbiome is being actually introduced to this stuff as their baby's swallowing some of this fluid. But also, as the baby comes down the birth canal, it's very important the baby gets a gulp of the mother's vaginal fluid, which has bacteria. If it's beneficial, if the mother has a healthy vaginal region, the baby's going to get good bacteria. And that's why vaginal births are so important as well, to feed the bacteria in the gut. We know now that that's very important.
And as is mother's milk and nursing a newborn, naturally nursing a newborn versus bottle feeding, because so here's what happens. As the breast is very soft, the baby latches on, and it actually will take the tongue will actually go to the root on the soft breast, is able to latch on, and that latching causes the tongue to be in the correct position, which is in the forward position, and it actually helps to develop the orofacial musculature as the baby is developing. And it's really super, super, super important. I encourage every one of my patients to, as much as they can, to nurse their newborns, and also nurse as long as they possibly can. And in some countries, they nurse for very, very late, but you're giving that newborn all of its immunity. You're giving it all of the natural stuff that, basically God gave us.
Yeah. Now, is there any studies to show that breastfed babies have better teeth development and also less cavities? Is there any studies like that?
I'm not sure about the less cavities, but I can tell you about the fact that a nursed baby, the tongue position, and without these pacifiers and without these sippy cup things, the tongue is in the proper position, and the tongue has 12 muscles in it, and it acts like a natural retainer, and it actually pushes up on the palate, and it helps expand out the palate, and you have proper swallowing, proper breathing, proper eating, and you have closed lips. And what happens with that is you have your entire breathing complex is completely like the way that it's supposed to be. And so
Does that sucking on the mother's breast also help for you mentioned muscles? Does it help for the development of the jaw itself?
Everything. It's the start of human growth and development, literally. And that's kind of goes back to Dr. Price's research, Weston Price, where he went around the world and he was looking at the nutrition of everyone and the
Well, before you move on, let's just introduce people to who Dr. Weston Price is. He was a pioneer in this whole field of how the food and the lifestyle affects not only the teeth and our oral cavity, but also our health in general. And he was back in the early 1900s. He was actually on the board of the American Dental Research Foundation. I think he was a president back in 1950 or something like that. He was quite a pioneer and did a lot of research. And so that's what we're talking about, Dr. Weston Price. And he wrote a book called Nutrition and Physical Degeneration.
Our nutrition is so vastly important, and the amounts of nutrients and the nutrient density of the food as well, because those micronutrients that our body actually needs for it to work is super, super important. And when we are eating the proper foods, we're actually getting the proper growth and development, and if you will, drink, like when children drink from a cup. They are actually, it's the tongue forward position. It's not a retruded tongue. Then their whole breathing apparatus is actually going to grow and develop. The structures of the maxilla, which is up here. So this is your maxilla, and then your mandible, which is, it's a bone all by itself. This whole complex actually grows. And believe it or not, Case Western Reserve were pioneers. They took the Bolton brush study was done in the 1940s, 50s. They took take babies in the womb, and they followed growth and development until they were 50 years old. There were no more cancers or anything of that nature to those children, and they were followed for the 50 years. And they found that they followed the entire growth and development, and they figured out how important, like tongue position, how important the way that the mandible grows, and how they figured out how our jaw grows. And we really don't stop growing, and especially boys, they don't stop growing till way in their 30s.
Yeah.
Or early 30s.
Well, talking about Dr. Weston Price, his work was quite extraordinary. What he did is he went around the world studying people of, the natives, the traditional diets of people. For example, in Switzerland, he looked at the people who were the Gaelic people in Switzerland who ate traditional foods, and then he compared their diets and their teeth and their oral health compared to the people who lived in the cities in Switzerland, and saw a dramatic difference, and saw that the people who ate traditional diets were extraordinarily healthy, didn't have cavities, and the ones in the city had oral cavities and oral problems in their mouth, and it was significant. But he did that in several different cultures, including working with American Indians here. He also did a study, which I thought was really interesting, because people are bashing cereal grains like wheat today and rice and these other grains, and they're making them sound like they're the devil in disguise. Well, Dr. Preston, Weston Price, what he did is he took these Native American Indians. I think they were the Mohawk Indians. They had about nearly a couple hundred Indians that had about 70 to 75% of periodontal disease or oral disease, and they were eating subsidized food from the government, and it was just refined junk food that the government dishes out. And then he took those people and put them on cereal grains like whole wheat, and put them on whole foods and fruits and vegetables and all whole foods. And he cleared up all of the dental disease, 100% of those people of those Indians. Isn't that amazing?
It is amazing because it's all about the proper nutrition, and he took out all the refined foods. So anything that's ultra processed, anything that's super processed, anything that's in the middle of the store, you pretty much should not be eating, really.
Absolutely. Well, he
Especially,
definitely demonstrated that it's not whole grains that are bad. It's the refined grains. When you process them, you get the white flour and the white sugar and all the very, like you said, highly processed. That's what causes the problem. When you eat whole food, whole cereal grains like rice and wheat and barley, you actually reverse disease, and that's a very big part of his research. So that's pretty exciting, and people need to take heed of that and look at cultures around the world that today still eat their traditional diets and are extraordinarily healthy. And I'm very familiar with the blue zones, which I'm know that you're familiar with. I know your family heritage is from Greece, and the Greek heritage. Well, that's one of the blue zones, and they eat whole grains, and they eat a lot of
a lot of pulses, a lot of all different kinds of beans, all different kinds of, and they're prepared all different. And then we have tons and tons and tons of greens, all different kinds of greens. Like, and it's everything. Here's the other thing that people have to really realize: you need to eat seasonal and everything that is from your neighborhood, if you will. So if you have farms around you, you want to go visit those farms, and whatever the farm stand has today, that's what you really should be eating, because that's the best nutrient density food that you can have. And when you eat seasonal, you don't get tired of it. You're not having blueberries off season. You're not having, if you will, you're not eating the same greens over and over. So everything has its season, and I think that's really something that we've kind of forgotten about, so to speak. But I'm a very large proponent of you got to eat seasonal, because that's what they do in Europe, and that's when you kind of look at Europeans and even South Americans. Most of the South America is the same way. Everything is seasonal. Everything's from the local. They're not putting hormones in everything. They're not crazy. Their foods are clean. And when we look at what is happening here in the States, it's really frightening to know like everything's sprayed with glyphosate, whether it's organic or not. So you think sometimes that, oh, I'm getting something because it's organic. That doesn't necessarily mean that it's clean. Mm-hmm. So you really have to I don't know, Doc, if you do this, but I do the baking soda water for at least 30 minutes with greens, any of my fresh greens, and do some vinegar water and stuff. And it's amazing how much stuff comes out, especially when you put the baking soda in. Oof. Forget about rinsing it with a lot of water, but the amount of stuff that's off of there is really, and then especially these box containers of oh, it's super washed. You don't have to wash it. Yes, you do. You actually have to wash that probably even more so than other greens, but yeah. And that's, again, it's really remarkable, and you have to be really well versed when you're reading labels is super important. And
yeah, you mentioned something about getting local and knowing where you're getting your food from. When you know a local farmer that's growing the foods organically and not using toxic chemicals, actually, I don't actually wash the vegetables very much, to be honest with you, when I get it and I know they're coming local. Now, of course, I'm not going to eat a whole bunch of dirt, but if there's a little bit, I don't mind it, because there's good bacteria in there. And there's good research to show that if you have a little bit of that soil bacteria, if it's got really prepared without toxic chemicals, is actually beneficial. That soil bacteria has a lot of benefits to the microbiome. But the other thing I want to ask you about, and you mentioned something a few minutes ago I thought was very important. You said that getting variety is important. The more variety we have, the more diverse our bacteria in our gut and our mouth is going to be, right?
Absolutely. That is 100% correct. And the reason why I was saying about washing fruits and vegetables, most of us are going to the local grocery store and are trying to find the market that has the most, if you will, clean clean grown produce and stuff. If you're going to the local farm, it's a little bit different story. But again, it's still eat seasonal is most important.
What's really important, Dr. Christine, is that we try to buy organic when we can. And there's a lot of reasons for that. But, my grandmother was not educated. And yet, this is what she said. And I always tell people this when they tell me they can't afford organic. I say, my grandmother said this: you can skimp on the house that you buy, the house that you live in. You can skimp on the car that you drive. You can skimp on the clothes you drive, the clothes you wear, but don't skimp on the food you put in your mouth. And I think that's a very wise thing. And the last thing I want to say about that is you can buy organic if you buy on sale, especially, and eat on sale.
Yeah, I agree with that.
So here, Dr. Christine, talk a little. Are there other conditions besides colon cancer that you're aware of linked to the oral microbiome?
Sure. So a few things. So the for everyone to understand, the tooth and our teeth, if you will, are surrounded by the pink gums, and they shouldn't have little red lines, and they shouldn't be like inflamed and angry looking. If they are, that means that there's bacteria or a bacteria biofilm stuck up underneath that gum tissue, and or there's a piece of calculus, which is calcified plaque on the tooth structure that's actually like a sliver in your finger. So if that doesn't come off, if you will, readily with a toothbrush, then you really should seek a professional, dental cleaning, because those little slivers of calculus and hard stuff up underneath the gums cause an infection, and it's a true infection. And what it does is it separates the gum tissue from around the tooth, and the tooth needs to be sealed with that gum. Our gums are designed so that they form like a seal on the top of a bottle when you're closing a cap, and it closes the bacteria from the oral cavity so it stops it from entering the bloodstream. When those gums are all inflamed, the bacteria from our oral cavity is actually now getting into our bloodstream. When it gets into the bloodstream, in some instances, certain bacteria have been found, and cardiologists have found them when they go under pathology. So a person who's had coronary artery bypass surgery and all of that kind of stuff, they've actually opened up the arteries, and they have found bacteria that has come from the oral cavity. And that is the bacteria that is causing inflammation on the inside of our blood vessels. And it's indiscriminate as to where it places it. So that is why it's so important to keep our mouths as clean as we possibly can, in the clean meaning that we do not want any inflammation of our gum tissue. So
those compounds that are released from the bacteria are very, very toxic. Like some of those compounds are like cytokines and other inflammatory compounds. As you said, they get into the system of the blood and can travel anywhere in the body and cause inflammation outside the body. For example, there's research studies that show that rheumatoid arthritis, which is a really serious form of inflammatory arthritis, with a lot of ramifications, is caused by one of the factors caused by the oral bacteria living inside of the mouth. So that's something that people need to recognize. Also, inflammatory bowel disease, like colitis and ulcerative colitis, and Crohn's disease. Those diseases have been linked to the bacteria living in the mouth, the harmful bacteria. So you're spot on saying that these things, they travel through the entire body and trigger many kinds of illnesses.
Yeah, it's really important to recognize that. And when that bacteria enters your bloodstream, it's all over your body. And in the heart, it's called a heart attack. In the brain, it's called a stroke. And so these are bad things. We don't want those things to happen to anyone. And that's why I feel it's really important that you have you're very stringent with your oral care. the things that you do and how you eat and your lifestyle, and you need a lot of probiotics. So all of the things that are good for your gut is good for your mouth. So
Dr. Christine, what percentage of people that come into your office are affected with gum disease?
when they start, so in the general population, approximately 30% of the population has
Wow.
periodontal disease. In other words, that they've lost bone. So 30% is significant, and it's 30% 18 to 36 years old. So it's even in a younger population. So having gingivitis, which is inflammation of the gums, having the gingivitis that goes on to losing bone. When you start losing bone, that is called periodontal. That is called your early stages of periodontal disease. Can you arrest that? The answer is absolutely yes. And it's what you're going to be doing. And you could be 20 years old, 25 years old, where you already have bone loss. And that is really, it's significant because that can also spur on, because your oral cavity is a complete, you're having so much stuff going on and so much inflammation in your mouth, that now that you potentially have a higher risk of becoming a diabetic. And then if you're diabetic, you need to have more cleanings. And they have shown that by, if you will, by decreasing the biofilm in the mouth and by using biofilm reduction protocols, in other words, cleaning off the bacteria biofilm layers that are stuck on the teeth and disrupting those, and that's what happens with the professional cleaning.
Yeah, we'll get into talking about, some of the things that you actually do in your practice to help to alleviate that. But before we do, let's kind of talk a little bit more about the complications, because these are very serious. You're saying that 30% or more of the American population has periodontal disease, either gingivitis or some other kind of oral condition that is causing inflammation that's then spreading through the entire body. That's traumatic.
It is traumatic, and it's only going to get worse, especially if people don't pay attention to it. And saying that, oh, I'm young, being that you're under, say, 35, that, oh, you're not going to get that till you're much later. You're going to start losing teeth. And once you start losing teeth, it's a whole cascade. And then you're at higher risk for having a heart attack. So, and they already know that a patient who is a cardiology patient, in other words, that they've been told that they've already had a heart attack, or they have to have coronary bypass surgery and stuff, they know that it's literally stemming when they start looking in the mouth, that a lot of those patients, a very significant portion of those patients, actually their mouth is a disaster and they have high amounts of inflammation, and that's what's causing, and if you will, inflaming their all of their arteries and all of their veins and so forth. So it's significant, and this is why it's really, really important to pay attention even at a young age. When you've got bleeding gums, spitting blood is not good.
This is an interesting question I'd like to ask you right now. So let's say your boyfriend or your girlfriend or your husband or your wife has gingivitis, has the wrong kind of bacteria living inside their mouth, and they're kissing. What chances does the partner have of getting that condition themselves or disrupting their oral microbiome and changing that? How does that play in?
That's going to play significantly. I've actually tested husband and wife like husband and wives oral bacterias, and they share pretty much, depending on how long they've been married and stuff. They share their biomes are shared. So you want to make sure that your spouse is going to be just as diligent about home care and everything else as you are, because you're going to be sharing that. And there's many studies that mom's saliva transfers the Streptococcus mutans, which is one of the bacteria that is known to cause cavities. There's many bacteria that cause cavities, but that's one of them. And they have shown that it transfers from mother to baby in children.
Wow. So that's really behooves husbands and wives and boyfriends and girlfriends to make sure that they're both taking care of the bacteria living in their mouth and their gut, because we talked earlier, the connection between the bacteria living in the gut and the bacteria living in their mouth have a communication going on, and they basically are transferring information and compounds and inflammatory nature between each other, causing significant havoc inside the body if they're not in balance. So we got to really educate husbands and wives and boyfriends and girlfriends to really behooves them to take care of their body and eat right and live healthy as well.
And I think that it's really important that if you have a spouse or you have a boyfriend, girlfriend you're like, something's not right. They need to really be checked, because then it's going to come on you. You're going to end up with those cavities. You're going to end up with gum disease. You're going to end up with problems, or swapping the bacteria that you really don't want, those high levels of bacteria. And that is significant. So it really is, it's a real thing.
Okay, well, let's kind of shift from talking about these gum diseases that are so dominant. And by the way, and in your estimation, when you first started practicing, was it about 25 years you've been practicing now?
28.
28. Have you seen an increase in the amount of gum disease and cavities and just periodontal disease in general over the past 28 years? Has it increased or decreased?
Oh no, it's increased. It's definitely increased. And I think part of the fact is that the amount of sugar that has been added to absolutely everything in our diet is causing that. And I believe that the amount of seed oils that is in the food as well is also causing high amounts of inflammation. And when people are not eating if you will, they're not eating as many fresh fruits and vegetables, high vitamin C. Vitamin C is super important. Vitamin D is super important. The vitamin A, which is all your orange vegetables. So basically carrots and your sweet potatoes, and like right now, pumpkins in season. All of those are super important because you're getting all those right nutrients that you actually need. And
it's really interesting that you mentioned, those as anti-inflammatory with the compounds that we call them bioflavonoids inside. That's what gives it the orange color, and these are bioflavonoids. But Dr. Weston Price, we talked about him earlier, he was giving his patients in his protocol, he was giving them also cod liver oil, which is high in vitamin A and other compounds that are anti-inflammatory, the omega-3 fats as well. So he had the vitamin A and the omega-3 fats, which boost the immune system and have those compounds that help to really strengthen, the bones and heal the bones like he showed.
Yes, that's absolutely true.
Mm-hmm. So we'll talk about fructose now. Let's talk about that, because that compound fructose, an isolated sugar that's found in fruit, but they isolate it and it becomes a toxin. Talk about how that is so deleterious to our oral microbiome and our health in general.
So, so there is fructose in fruits, a lot of different fruits. However, that fruit has fiber. It has the peel. So like, if you will, an apple, apples also have, and not only are they high fiber, they are high in vitamin C, and they have pectin, and the pectin aids in digestion. So that amount of fructose takes a very, very long time for it to be processed. And so that fructose is not going to bother your body in moderate consumption. Whereas high fructose corn syrup is a whole different ballgame that should not ever have been put in our foods. And there are 60 known names for sugar that is placed in our food. 60. Like, not like, it doesn't say just sugar. There's maltose and there's a million, there's literally those 60 different plus names that are names for sugar. And those have been added to all of our processed foods. What happens? So a sugar molecule has two parts to it. It has glucose and it has fructose. The glucose, our body knows what to do with it because there are actually glycolysis and gluconeogenesis and all of the ways that our body processes glucose. And our body does need the glucose. However, fructose remains completely unregulated in our liver. The fructose molecule, when you have high fructose, it decreases the amount of nitric oxide in our body. That will increase our blood pressure. It increases an inflammatory factor called JNK1. JNK1 does not turn the leptins off in our brain. When the leptins are not turned off in our brain, it doesn't tell us that we're full. That means that we continue to eat, and that's how we start to crave sugar. It's almost as if it's a drug. The other thing that it does is high fructose will cause high triglycerides. So if anybody has cholesterol issues, your high triglycerides, you're trying to figure out, well, what did I eat? Sugar and or something that was processed. So any processed foods, whether it's cookies, and if you're not eating cookies, but you're eating crackers and you're eating spaghetti sauce and start reading those labels, because it's the amount of carbohydrates and the amount of sugars that they've actually placed in the food. 1 pack of sugar is approximately 2 grams of sugar. When you see 12 grams of sugar in a serving, that means that you're eating 6 packs of sugar in that one serving. And that one serving could be a half a cup. So it's really, really important to understand the amount of sugar in the food. So it's increased your triglycerides, so that's your high cholesterol. It also causes a buildup of fats in the liver, and this is called non-alcoholic fatty liver disease. And this is really, really super important to understand, that non-alcoholic fatty liver disease is actually coming from a high sugar diet. And when that liver gets nice and fat, just like a goose, okay, your liver will not be able to function properly, and then you start having liver problems. So that is a big deal, and that is just like someone who has an alcoholic who has sclerosis of the liver. That's exactly what happens to them. So it's really, really, that's also very, very important. So our liver is the place where, from when we eat food, it goes down into the stomach, and the stomach is actually a tube, the small intestine is actually a tube. And when that tube is normally shut, okay? And when the lumen of the gut, is exposed to sugar, and it's exposed to sugar molecules, it starts to open those little tubes, the things that hold the gut together. It holds them together, and it opens. And when that opens, it allows the sugar molecules to go right into the bloodstream. And that is what is going to the liver, and it gets processed in the liver. And when that occurs, that's when you start having all the fructose metabolism is completely unregulated in the liver. And we have they've known about this for a very long time, but it's only truly been explained, and Doc, you can talk about it as well. It's only been explained in the last several years, in the last basically 8 to 10 years, that they've actually truly figured out the entire fructose metabolism and how it actually, how everything is metabolized.
Well, Dr. Christine, you mentioned that there is fructose in fruit, and people do not have to fear eating fruit even in large quantities, if they're eating a whole food diet. There is a really very interesting doctor. His name is Dr. I'm going to probably smear his name, but it's Cyrus Kambata. And he's written several books on mastering diabetes. And he's shown that you can eat a lot of fruit and not have to worry about diabetes. And you can reverse diabetes actually if you're eating whole foods. So the fructose that's found in the foods, in the fruits, is something that's not going to cause problems. It's the isolated fructose that you're talking about that
That's
causes
correct.
problems.
Yeah, and what's really important to know about that as well. So there's a bunch of amazing doctors out there. There's Dr. Jason Fung, who's a kidney doc, and he's written a bunch of books about diabetes and how you can. He goes through how you can actually cure your diabetes and make yourself better. You can help cure. He basically because end stage kidney disease is horrific when you're stuck on a dialysis machine so it can filter your blood. It's a horrible, horrible way to, like spend your life. So that's how he ended up doing tons of research. And he has 3 books or 4 books, and he's a really wonderful resource. The other person is Dr. Robert Lustig, Lustig, who is a pediatric neuroendocrinologist, and he's written a bunch of books, but one of his books is called Meta Diabolical. That's a great book, especially for people who are not familiar as well with like a lot of medical terminology. He does a great job of having you understand how sugar works in your body. It's really, really important. And once you start recognizing that, you really recognize that you can't have added sugars at all, and you really have to pretty much, you're kind of cooking at home, and you're following as much of a whole food diet as you possibly can.
Speaking of whole food diet, Dr. Christine, let's talk about the principles that you use in your practice based on the type of dentistry you practice. There's 4 principles. Can you talk about those?
Sure. So the first is kind of like it's your food and what you drink. So it's the food and drink that you're placing in your body on a daily basis. It's the amount of sleep that you're getting. If you're sleep deprived, you're going to always reach for higher carbohydrates and also fast things that are going to give you energy because your body is deprived of sleep. So sleep is super, super important. Then the other one is mindfulness, meditation, if you will, because when you are under high stress, your brain is not functioning the way that it should be because you're under high stress, because it's on a fight or flight, which is natural to us, that we're trying to fight all that off. And so we're not sleeping as well. We're not, it's a whole, so doing mindful exercises and prayer, and they've actually physically shown that prayer actually will take you to a different place, and it changes your brain chemistry and the so forth. They've done MRIs with patients. They've done all kinds of testing and stuff, and they find that it completely changes your brain, and it's really important. So, and if some people are not into praying, it's fine. You can use mindful meditations, and there's all sorts of things that are really, really important. The other thing is movement, and moving your body on a daily basis and walking is super, super, super important. And being outdoors, smelling some fresh air, getting some sunshine, at least 20 minutes a day of sunshine, that is really, really important to our, if you will, overall health. And it actually helps us in a lot of different ways, because when fluid is moving through our body, it's not staying put. And when it's not staying put, you're actually able to metabolize better. And they've actually shown, like, In Europe, they take long walks after dinner. They take their evening strolls. Well, basically what they're doing is they're moving their body. And that's why if you look at Europeans versus Americans, they're much more slender. They have a whole different, they live to work, we work to live. So I think there's a lot to be said about us, of how we eat, how we sleep, and you should take time to eat also. It shouldn't be a 5-minute thing as well. It's really, really important.
Dr. Christine, this is the kind of thing that you teach your patients. So when they walk into your office and they become a patient of yours, you're teaching them not just about how to take care of your teeth, but you're showing them that the teeth and the oral health are connected to the rest of the body. So you're teaching them, and it's integrated in their whole lifestyle that you're sharing them. So this is wonderful. Now, let's talk a little bit about, you mentioned talking about the oral microbiome in the mouth. Do you test in your practice for the oral microbiome and see the type of bacteria people have living there?
Sure. So when I see a lot of inflammation and I see a lot of, I suggest that we do what it's a saline rinse and spit test, and then that saliva bearing, if you will, it gets tested, and there's a company called Oral DNA, and they will test and give us a range of, there's like 15 to 20 bacteria that they will test. And they know that there's certain bacteria that if you have periodontal disease, that are going to be high, or that you have high cavity rates. There's those bacteria, and so we have ways of dropping those bacteria down. And I also try to use many products in the office that are, if you will, alleviating antibiotics and alleviating, if you will, as much commercial stuff as we can, so that can kind of bring back the balance in the patient's mouth. And so there's many ways of doing that. And one of them is with my cleaning products. So I use a Swiss cleaning technology, which is like, if you will, it's, for lack of a better way to explain it, it's power washing the teeth. And by power washing the teeth, it's a guided biofilm therapy. And by doing that type of guided biofilm therapy and showing you the areas that you should pay a little more attention to, use your soft toothbrush with, using different little brushes if you have spaces between your teeth, or using a water pick with a little bit of salt water, and making sure that you're taking care of yourself. And then also with the foods that you're eating, your sauerkrauts and your yogurts and your kefirs that have lots of probiotics in them are super important. Also taking an oral probiotic. There's many different ones out on the market, but there's some that are better than others. And these are all things that can help change that biofilm, change that oral bacteria so that it's more. And the other thing, really super important, there was a huge study done in the fall of 2019, it was released, and it showed that commercial mouthwashes, especially ones that had high alcohol, especially ones that had alcohol in them, completely disrupt our oral microbiome. So that is something that I do not recommend at all. So if someone is taking any kind of mouthwashes, I try to get them out of a commercial mouthwash. Just use plain salt and water if you're, not able to do anything else. And sea salt. So what I normally recommend is a teaspoon of sea salt, and you're placing it in a coffee cup with a little bit of hot water. You dissolve the salt, bring it up to room temperature. You can gargle with that as often as you wish. If you want a flavoring, add a little bit of lemon to it, or make a peppermint tea, and you can, do that and rinse with
Is there
that.
any commercial products that you recommend for mouthwashes that are safe to use?
It's truthfully, There's very few out on the market right now.
What about Tom's? Tom's has some things. You ever looked at Tom's?
Tom's has some good stuff. There's the closest. There's a couple of them out there. There's the Thera. I forget the guy. There's there are a couple out there, but you've got to be really careful as to what the ingredients are because.
Okay, what about toothpaste now? Because people are using commercial toothpaste, and we want to talk about in a minute here fluoride. But what about commercial toothpaste?
So commercial toothpaste, you want the most important part about commercial toothpaste is you want to use basic toothpaste. So if it's like the basic Arm & Hammer, the basic Sensodyne, if you have sensitive teeth, a lot of the toothpaste have high amounts of sand silica in the toothpaste. They're allowed up to 200 parts. If the toothpaste says that it's tooth whitening, that is definitely a big bad no because it's not really tooth whitening. It's actually, it has a high amount of sand silica in it. So in other words, it's like using sandpaper on your teeth. And so once your enamel goes away, we can't put it back. And so, and that goes for hard toothbrushing as well. So when you're hard toothbrushing and you have a very acidic diet, you're going to start to erode away the cheek sides of your teeth. And then you have what we call recession. So all of that kind of stuff is really, really important. So you want to use a toothpaste that is below what's called an RDU. An RDU is a relative, it's how much sand silica is placed in the toothpaste so that it doesn't erode the dentin surface of the tooth, which is the root.
Yeah, you mentioned Armor. What's their level of that?
Oh, wow. You're really reverb there. I'm sorry, say that one more time.
What's the level in the Armor toothpaste for the silica? What's the level they have?
So Arm & Hammer has a couple different toothpastes. They're basic. So the Arm & Hammer Dental Care toothpaste, which is their basic one, is 35. Pro Enamel is also a good one, which is Pro Enamel, the Sensodyne brand. That's a 37. So anything that's below, but a lot of the Arm & Hammer and the Sensodyne is actually pretty good. The Tom's of Maine Sensitive is also pretty decent. That's a 49. The Crest Plus Scope Flavor, that green gel is 51. So those are actually pretty decent, and closest is a 53. You just want to stay away from those, the whitening toothpaste. Those are just the worst. And you also want to
what about the toothpaste with things like tea tree oil? That's the one I use.
Tea tree oils are really, really good. They are, the tea tree oil is really good because it's antibacterial and anti-inflammatory. Also anything that has neem oil in it, that's also antibacterial, antifungal, anti all kinds of stuff. The other things that are good are like the Pilu as well. That's another good one. Our Auromere, that's a decent toothpaste. Though there's a Wella brand toothpaste that's also fairly decent. So there's a couple of them out there, and I usually so as far as fluoride toothpaste. So fluoride, I leave up to each individual patient. I try to stay away from using high amounts of fluoride for patients because fluoride is everywhere, and fluoride is toxic. It is not a non-toxic. It's 200 milligrams. As we were talking about doing this, sodium fluoride is what is normally in most of the toothpaste. It's 0.24% sodium fluoride. And sodium fluoride, 200 milligrams of sodium fluoride it basically can kill somebody. So 200 milligrams worth of that. 3 to 5 grams or a teaspoon can kill an adult. One of the biggest problems with water fluoridation is if there's aluminum in the water, it'll form aluminum fluoride, which is a complex. and that interferes with our hormones. It interferes with neurochemicals. And in countries where there are some areas, so like here in the United States, Colorado, certain areas have super high fluoride. And back in the early 1900s, they were doing a whole bunch of investigating and stuff, and they couldn't figure out why people had brown teeth. And it was actually because of the high fluoride amount. And the things that happen with high fluoride is fluoride seeks out our bones, and it's not good in excess because it can cause osteoporosis, it can cause arthritis, it can cause brittle bones, it could cause cancer, infertility in women, and infertility in men.
What Robert F. Kennedy wants to do in getting rid of fluoride out of our water supply. They're thinking that he's crazy for doing that. And I know for a fact that there's, as you said, so many illnesses that are linked to fluoride. What do you think about his position?
I don't think that he's crazy. I think that it being in the water supply is not the place for it. We can use it topically, but when and per so I use it topically for patients who actually need it in certain instances because of medications that they're taking due to it. Even for high cavity rates, you can use some types of fluoride that are actually will help strengthen the enamel of the tooth, but it's placed topically. It is not ingested. You're not supposed to be ingesting the fluoride. Fluoride is not good for us to be ingesting.
Well, once
And
again, going back to what Dr. Weston Price did, he cured all the people with dental cavities and periodontal disease just with a whole food diet. So, do we really need fluoride?
so if and so I'm gonna place this question back. If ever since they've added fluoride to our water supply, they it is difficult to prove that it has changed the cavity rates because it really hasn't. And so in Europe, they are not using fluoride in the water supply. It is not permitted. And so we should not be using fluoride in our water supply. There's fluoride in many, many places. And there are some parts of the country that they have in their water naturally. They have high fluoride, so they don't need to have added fluoride. And you may say that some people may live like in a food desert where they're in a urban city center and they don't have fresh fruit, they don't have fresh produce, they don't have, and that those people need to have fluoride in the water supply. If you're using dental toothpaste, which most people are, they're getting the amount fluoride that they actually,
Well,
would
you
need.
mentioned people living in the inner cities getting the foods that are not healthy. They're getting government subsidized food supply, which is terrible. And that's another thing that Robert F. Kennedy wants to change to make sure that people who are using food stamps can't buy Coca-Cola and potato chips and donuts. They have to buy healthy foods to help to keep their mouth healthy, their gut healthy, and their entire body healthy. So I think we got to get to the root cause and not treat symptoms with things like fluoride toothpaste or fluoride compounds or putting fluoride in the water. We've got to get to the root cause, which is our lifestyle, which is the four tenets that you talked about earlier.
And it's also very, very important that children of every walk of life understand where our food comes from. And there's a gentleman in the Bronx that in here in New York who has started to change, and he's taking it. I think he's taking it national, where he put a garden in one of the schools, and they started doing gardening stuff, but where the kids really get involved, and then they understand how their food is grown, and they understand. And this is not something that's really difficult. It also gets children outdoors in sunshine, in understanding not only the food, but how to eat and how to, like, there's so many great factors of that. And it also gives them a sense of community. There's so many, if you will, great things that are occurring for those children. And that is really, really, really important. And I think that it's having an educational system where the children know where the food is coming from, not like there's a brown cow that makes chocolate milk. No, the brown cow does not make chocolate milk. Chocolate is actually placed, and lots of sugar is placed in that chocolate milk as well.
Sure. Well,
But
Dr. Christine, we're just about run out of time here. I want to ask you an important question.
sure.
What is your mission as a natural dentist? What would you like to see happen with your patients, and what is your real passion?
So my real passion has been, I was proved this during the pandemic, and it really hit me really hard during the pandemic. We were shut down for 14 weeks, and I have spent my entire career with my patients in New York City. And through all my patient pool in 14 weeks, I only had 6 people who had true dental emergencies in that 14 weeks. And that tells me that the preventative care that I have, and if you will, and helped patients with, and for them to understand their own bodies, it allowed my patients to be healthier and to get through something like the pandemic. And of course, there were many people that needed cleanings and they wanted their cleanings and so forth. But at the same time, it was all about that, like you're doing the right thing. These are things that we, like all the little things that you do on a daily basis, what you're feeding your children, be really mindful about that. Being mindful about taking time out, the 5 minutes that you need for you, whether it means going for a walk with the dog, and taking the dog out. All of those little things are super important, and that we need to kind of, step back from devices and actually a lot of human interaction. And that's I'm kind of bringing people back into, if you will, old fashioned, if you will, whole foods, taking care of yourself. And it's when you take care of yourself today, tomorrow, well into old age, you're going to be able to function and do all the things that you love to do. And that's
You mentioned the pandemic. The researchers have shown that a significant portion of people who ended up dying from COVID had periodontal disease. A significant portion.
that yes, and that is when again, it goes back to taking care of yourself, and it's a portal of entry. The amount I saw many people before I even knew in January that COVID was even a thing. We had no idea. It looked like it was a virus. There's a childhood virus called Coxsackie virus. Patients were coming in with punctate lesions on the roof of their mouth and complaining that they were kind of having taste things. And I was like, listen, um, you know, use mouth rinses of, saltwater rinses. Let's treat this like as if it's, do some high vitamin C, do some, punch up on your zinc and your, usually zinc glycinate. The Cold-EEZE tablets are really excellent because it's a palatable way to get zinc in your body. So I basically use the basic stuff that I do for anything else that when a patient, and most of the time, patients are not coming. So we've always had this thing in my office where we really don't let people that are sick, and my patients always know if they're coughing or sneezing or whatever, they're always, that patient is excused absence, so to speak, and is not going to be coming in to visit us until they're over whatever it is that they have. And so that stuff is really, really important. And, I think that has been a tremendous player in how I basically treated that just like anything else. Like it looks like it's a virus, it's like do some mouth rinses and, get your vitamin C up and
Sure.
get your
Well,
zinc
Dr.
up.
Christine, we're gonna look forward for you coming and opening up your practice. It's going to be in Medina. And do you have any projected dates for opening it up?
Sometime toward the end, hopefully by December 1st, we're going to be up and open, and or January 1st. We're trying to do a soft open and still have a couple pieces of equipment to get in there, but it's Medina Dental Corp, medinadentalcorp.com. You can, give us a shout out there, leave your email, and we'll be more than happy to send you when we're opening and stuff. It's really exciting to be able to bring forth new technology and things that are going to take the fear and discomfort out of dentistry that I've been practicing the way that I've been practicing for the last 25 years in New York, to bring it to Cleveland area and to Medina. And it's a wonderful community. One of the reasons why I've chose Medina is that it has essentially everything that we just talked about. Great local farms. There's a farmer's market. You can walk around everywhere. And there's plenty of wonderful restaurants as well that are using local produce and local grass-fed, grass-finished meats. And so all of these things are really, really important. And there's a great sense of community. So
Good.
it's really wonderful. I look forward.
We'll look forward to having you come into the greater Cleveland area, and we will certainly let our patients and our listening audience know about you coming in. So once again, thank you for taking the time coming on the other side of medicine today. And we'll be talking to you soon. And thanks once again for sharing all the information you did today.
Thank you so much. Greatly appreciate it.
Take care.
Thank you.
Adios. Okay.
Bye-bye.